Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Before we start, I'd like to acknowledge to the traditional owners of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and recognise their continuing connection to land, waters and culture. I pay my respects to their elders of the past, present and emerging. Well, today I've been looking forward to this conversation ever since I met our guest earlier in 2020. My guest today is Dr. Howard Hindin, or Howie, as he prefers to be called. And Howie has over 50 years of experience in the dental world. He has a practice in New York. He'll tell you all about that. And his journey has been a particularly interesting one. And when I first met Howie, at the beginning of last year, through a guest on this podcast, Dr. Rosalba Courtney, who has done many podcasts with us on breathing, she suggested that she introduced us, and I'm so grateful that she did. I mean, at every stage in a professional career, I think you need a mentor, and I'm mentored by my partners, who some of which are older and some of which are younger, but they do mentor me. But I really look at Howie as a mentor because I've learned so much from him since we've met, and going to be sharing a lot of that with you today. So I hope you enjoy this conversation I had with Dr. Howie Hindin. Welcome to the show, Howie.
Thank you. Thank you so much for having me. This is very exciting to be here a day after you. I think it's Tuesday morning or Wednesday morning.
Yeah, it's Tuesday. It's Tuesday morning with me, and it must be Monday night with you, because I'm speaking to you. You are in New York. Where are you? Where exactly are you?
We're about 1 hour north of New York City, in the suburbs.
Yeah. And tell me, when we first met, Howie, we were introduced through our respective roles. You as president of the American Academy of Physiological Medical and Dental. Yes, the
Medicine and Dentistry.
Medicine and Dentistry, the AAPMD. And I was in my role then as the president of the Australasian College of Nutritional Environmental Medicine, and we were reflecting on the fact that you and I both found ourselves in this role as dentists, which we weren't surprised about, but I think some people might be. I wonder, before we lobbed in, because there's so much I want to talk to you about today, if you might just share with us a little bit about your professional journey to this point, because you've been in practice for quite a few years now, and you are still in practice. How did you get here?
So thank you, Ron. This is my 54th year in practice.
Yep.
And my goal was to really be a really great dentist and be good at all the things I learned in dental school, and which I did. And then around somewhere in the early 70s, I took a course in something called Mind Dimension. It was sort of because there was a dentist who was doing TMJ treatment. He said, this is a really good course. You can learn how to teach people how to relax and help them get rid of their TMJ pain.
Now, for our listener, Howie, we know what TMJ, temporomandibular joint, or the jaw joint to the ordinary punter.
Right. So there's this joint where our lower jaw and upper joint meet, and problems related to that have been called the great imposter, because it could appear as many different things. So somebody suggested I take this course, and in this course, you spend 4 12-hour days going through different relaxation techniques, because between when we're awake and when we're asleep, there's this little spot between awakeness and sleep, which is called the alpha state, where you can reprogram yourself, and that's where you go when you're hypnotized or something like that. And when I took it just so that I could learn more about what I do, and I could do it better. But it really was life-changing because it was the last headache I ever had in my life. I never had another headache. And all of a sudden I said, there might be something other than what I've learned in dental school that might have value. And that started me on a journey looking at things like acupuncture, nutrition, homeopathic medicine, and mindfulness and things like that. And so that was back in the 70s. And then I got involved and we formed a study club where we bring people with, back in the 70s, there were a lot of people with very bizarre ideas. There was a dentist from Western United States named Willie May. Did you ever hear of Willie May?
I did hear of Willie May. I think I use his kind of appliances still to this day.
So Willie May was a dentist, and a little bit of background story. He had cancer, and his father was a physician. And he said, and he had terminal cancer. And he said, there's no cure, but we've heard reports that sometimes infections from teeth or something from teeth could be a factor. And so he had all his teeth removed, and he had dentures made for himself.
Wow.
And he seemed to be doing better. But then he noticed that he kept playing around with the dentures. He would adjust the dentures. He would change the height of the dentures. He would change the position. And he noticed that things made a difference. And that's how he started on his idea of making appliances that would fit over the lower teeth and reposition the jaw. And he would really fine tune them. He would just use like a very fine rubber wheel to smooth them out that would make a difference. So we had people like Willie May and George Goodhart, who was a chiropractor, who was considered the father of applied kinesiology, and other people like that. And there was a orthodontist at the time, John Witzik, who was sort of the father of functional orthodontics in the United States. And he was the first one who said, you really don't have to be a board certified orthodontist. You can do these appliances that were very popular in Europe, where you can reposition in the jaw, and you may never have to take out teeth. You could actually grow the mouth to fit the teeth, as opposed to the philosophy at that time, you had to take out teeth to fit the mouth. And so all of a sudden I was learning all these things that really blew my mind. This isn't something that was even mentioned. In fact, it was even considered somewhat radical. And if I wasn't going far enough down the rabbit hole, I started looking at the fact that mercury may not be a good thing. So once I got involved in acupuncture, there was a German Dr. Reinhold Voll, who did Voll acupuncture, and they would show how they would do testing, and that depending on what you put in your mouth, it would change the meridians. And with my little background in acupuncture, that what you did in the mouth had an energetic effect on the rest of the body. And that was even prior to the sort of the pioneer or the first person who talked about it in the United States, Hal Huggins. But prior to that, some of the functional or alternative doctors in Germany were doing this. We're doing this all the time. There were doctors who believed that who were treating cancer, that you had to have all your mouth checked, get rid of all the infections, get rid of all the metals that were a problem. And so I was finding this very interesting. And in probably 1970, 71, I eliminated all mercury from my practice. I was in practice with my cousin, who was older, and he was very understanding. He said, well, if you want to do this far out thing, it's okay, but can we just use up the mercury we have, because we had bought it? And I said, that's a good idea, but on who? If I wouldn't use it on my family or my children or my friends, what do we use it up on? And so that I stopped using mercury back then. And there weren't a lot of alternatives to amalgam fillings at that time, mostly gold inlays. And, certainly they were nowhere nearly as expensive as they are now. But there were no composites at that time. The other thing that was important in my on my path was I love doing surgery. I did some courses at Tufts in Boston. I was doing periodontal surgery, and then I got involved I was more involved in nutrition. So I said, let me do an experiment. Let me take the next 20 patients who come in with bad periodontal conditions who may need surgery. I'll do on half of them, I'll do the surgery, and on the other half, I'll just do nutrition. And let's see what happens. And I did that, and certainly right after the surgery, those patients look far better than the patient who did nutrition. But 6 months or later, it was completely reversed. First of all, those who had the nutrition, they were really working harder. They were doing their nutrition, they were doing their home care, and they just kept getting better and better. The ones who had the surgery looked really great, but as the months progressed, they started looking not as good, and that led me to this belief, which is really not so intelligent, that if you get people to buy into taking care of themselves, you're going to get a much better result than if you're the star. So even if I was the best surgeon in the world, that the day I finish the surgery, I get a good result, but I'm not really making a change in people's lives. So, and then the other thing, one more thing, there was a place in New York City called the Institute for Graduate Dentists. I don't know whether you ever heard about it, but it was formed after World War II in order to educate. It was one of the first people that provided education for dentists after dental school, and all the dentists coming back from World War II, they had GI benefits where they could take these courses and get them paid for. And the head of that was somebody named Myron Lieb. Myron Lieb actually wrote one of the chapters in Harold Gelb's book on TMJ, and he has a chapter where he shows you how to draw the guidelines, how you reposition the jaws. Mm-hmm. And they were talking, this was back in the 50s, about how repositioning the jaw could help children learn better in school, and earaches would go away. And it was very popular at the time. But then as more and more dental schools started offering CE, as a business, it became harder to run that. So I was on the board of that for a period of time. And so I've always been involved in what's happened. And the real difficulty was, how do you get the rest of the dental profession or the medical profession to believe that you can change something in the mouth and somebody could have a dramatic change in their health. My son is doing, I think I told you, a research study on Tourette's syndrome. And it's just about to be published, using oral appliance to treat people with Tourette's syndrome. And the result is, it's probably the best result compared to the other things like drugs. And the best secondary treatment is called alternative behavior therapy. So if you think you're going to have a tic or a movement disorder, you do something like you scratch your arm, or you pinch yourself, or you do something like that. But again, there was always the issue of what's happening. Maybe it's just the strong personality of the doctor, who just by the sheer weight of the energy they're putting out convinces the patient they don't have a problem. Although probably the placebo effect is probably good treatment anyway, if it works. Yeah. But now, in the recent years, we've discovered the importance of airway and breathing.
Yeah.
And that seems to be bringing everything together, because I look now at airway, sleep, and breathing, the effect on the autonomic nervous system, and the way that you can possibly investigate that, look into that, related to heart rate variability. And that seems to be, it took me 54 years to evolve to that place, but that seems to be the place where now I see that as the unifying factor. And as we were just talking before we started the podcast, I came across this article that talked about how important it is for physicians and dentists to work together. And I'm quoting from the article. It says that humanity should be so unnecessarily suffer for the maladjustment of medical and dental education is a serious reflection upon the intelligence of these professions. And it was from the Journal of the American Medical Association in 1900.
Wow.
So they were talking about how all our professions are getting together and working together for the benefit of the patient. That was 120 years ago, and we still haven't figured it out.
Yeah.
But hopefully there are things that are happening in the world today that give us a great opportunity to make that happen.
Yeah. Well, you've only been in practice for 54 years, so I'm guessing you're really getting the hang of it now.
And that's why they call it practice.
That's why they call it practice. And I used to, when we met, Howie, and I said, oh, look, I've been in practice for 42 years. You went, 42, easy. The first 42 years are the easiest. It's the next 12 years that, no, you didn't say that. You were very kind. But I know you have been on a journey, and in parallel, you have been ahead of me well and truly, and you've introduced me. For example, we're going to talk about heart rate variability, and I have been in practice for those years, but I'm still learning and you're still learning. There is just so much to learn. I think people are often surprised to learn about their oral health and the connections with general health. It's a topic we've covered here before. But just give us, you've touched on some of those. Let's bring it together and just, can you share with us what you see as those important connections?
Okay, so off the top of my head, I can think of four. Mm-hmm. One, as I mentioned right before, airway, sleep, and breathing.
Yeah.
So, and what does the dentist fit into that? Because we only get air through two means, through our nose and through our mouth. And even the air that goes through our nose has to pass through the back of our mouth and behind the tongue. If the structures of the mouth are altered, narrow arch, missing teeth, orthodontic retraction, bringing everything down, our tongue is actually the front wall of our airway. Anything that pushes our tongue back against our airway restricts our airway. And either, we all know about apnea. Apnea is when you stop breathing, but you don't have to have apnea to have a problem. A poor airway could lead to snoring. It could lead to something called upper airway resistance, where you're breathing, but you're working harder to breathe, or hypopnea, where you're breathing with at least 50% more difficulty, or apnea, where you stop breathing. The thing is, it doesn't matter which you have. It has exactly the same effect on the nervous system. Your brain is being challenged. You're under threat. Imagine somebody sneaking up behind you, putting their hands over your mouth and nose and not letting you breathe, and doing it continuously several times every hour. Think about what state your nervous system would be in. So that's would be the number one priority. Mm-hmm. Number two would be periodontal disease. They have found that the same bacteria that occurs in the mouth, P. gingivalis, is found in the brain of Alzheimer's patients and in the arterial plaque of people who have heart disease. Now, if we combine the two, then it's almost a perfect storm. imagine somebody with periodontal disease who now have bleeding in pockets, and now the barrier between that bacteria in the mouth and the rest of the body, that barrier is broken down, and the bacteria can get into the bloodstream. And now at the same time, they have an airway sleep problem. And when that happens, negative pressure builds up. What's negative pressure? If you were to be breathing through a straw, and I come and I pinch that straw, your lips would be sucked in, your cheeks would be sucked in. Well, what happens when your airway closes down, your chest wall contracts, puts pressure on the lungs and the heart, and actually it slows the blood flow from the heart. When that moment passes, that stored up blood that's accumulated gets released with a greater force. And that difference between slowing down the blood flow and speeding up is called turbulence. And when turbulence occurs, that turbulence bounces off the walls of the blood vessels, especially where there's a fork in the road, and it bounces off them, and it'll cause like a wound or irritation, which is the perfect place where that bacteria that's gotten in from periodontal infections will lodge. And since we don't like that, we put a bandage over it. And what's that bandage? That bandage is arterial plaque. So it's not only these two things, airway and periodontal disease, but it's how they occur together. Then we take the third thing, toxic materials, mercury. So many of the materials that are used may have negative effects. I'm sure that anybody who's listened to your podcast knows about the dangers of mercury. You've probably talked about it once or twice. But there are also the other metals. You know, back when I was talking about how gold was the alternative to mercury, gold is pretty good. It's pretty kind to the body, although gold is never all gold. It always has something else in it. But when the price of gold started increasing, they started looking for other things. They started looking at nickel or beryllium and other materials which have a lot of toxic side effects. In laboratory animals, if you want to produce a tumor, all you have to do is inject them with nickel, and 100% of those animals will develop a tumor. And now you're putting that material in a mouth that has acid and different and bacteria, and it creates a whole environment that's just primed for creating a problem. And now, if you want to just go back to what we were talking about. So now there are a whole bunch of dentists who say, you know, that stuff is bad. We need to get it out of your mouth, and we have to put you on a detoxification program. And there are wonderful programs. There's anything from nutrition to chelation to things like chlorella and things like that. But if somebody's not sleeping well and they're in a perpetual state of adrenaline-driven sympathetic upregulation, where they really are always in a defensive mood, they are not in a physiological state that will allow them to detoxify. And so that's often the missing piece, where you do everything right, you remove the bad materials, you use a rubber dam, you give them oxygen, you give them good nutrition. Some people will get better, and there are some that don't, and you don't know why. And since I've been doing this a long time, I have probably made more mistakes than anybody, but I try not to make the same mistake twice or too many times anyway. But when I went back and saw some of my patients who were unsuccessful, didn't get some of the results I wanted when I removed their fillings, replaced them, and those who had an airway problem, we treated that. All of a sudden, they began to move forward and improve because we found another piece. And then the fourth thing that I wanted to mention was oral infections. where somebody has an infection or around the root canal that that is not symptomatic, but is problematic. That if somebody has pain around the tooth, it's because that infection is trying to spread. Our immune system isn't letting it spread, and that pressure of the infection wanting to expand and the immune system trying to prevent it, that pressure builds up and it causes pain and throbbing. But if it's a chronic condition where you don't mount an immune system reaction, and that bacteria can just drip into the system, then you don't have any symptoms. Or if you do have symptoms, they may not be at that around the tooth. And there are all sorts of ways that supposedly you can detect it, including applied kinesiology and different things. But with the introduction of 3D cone beams, that teeth that look perfectly fine, when you take a 3D image and then you can spin around it and look at from an angle you never saw.
Total revelation. I mean, we sit around as a group, we're 5 partners, and we show each other cases, and collectively we have over 100 years or more of experience, but we are blown away by what we may have missed.
And that's before you can't see what you don't know. And you don't know, you can't know what you can't see. But now, between all the things that are available today, we have the ability to see more and know more. And one of the challenges is the line between medicine and dentistry. Really, I wouldn't say it's getting blurred. I think there really never was a line. It was an artificial line. I guess I'm not sure why, but I read about the history of medicine and dentistry. Then, in 1968 in the United States, when they introduced Medicare, dentistry fought not to be included in Medicare. They didn't want to be subject to the lower fees or be controlled by the government. And from 1968 to around 2008, every single year the average dentist did better than the year before, until the financial crisis. And if you're doing so well, my class in dental school was the first class with a high-speed drill, and then following that, there was the special rubber-based impression material, and so all of a sudden, dentistry could do so much more, and dentists could do so well financially just doing repair work. And doing all this work actually produces more work, because high-speed drill maybe it could overheat a tooth, maybe it could end up needing a root canal treatment. So then endodontics boom, and then maybe crowns don't fit as well. Maybe they're not shaped properly, or maybe the materials aren't good, which led to periodontal disease, which led to periodontal treatment. And so a lot of the repair begat more repair. And dentistry has done better and better. At the same time, the health of our country hasn't been better. I mean, you look at the statistics. We have so much COVID in our country, but if you break out the numbers, it's mostly people who are older, people who have coexisting conditions, comorbidities. Mostly the two of the greatest are obesity and metabolic disease, which are rampant in our country. And so, if you don't mind, we could talk a little bit about that.
Yeah, absolutely. I mean, you are when we first met, Howie, you were actually in the hot spot in America. New York was in a really bad way. And how are you seeing it all happening? How's it going in America?
Well, now everybody is just waiting for the parade to march down the street with the vaccine, so people can be vaccinated, and the reports it's 95% successful. But in the history of pandemics and diseases, there were always two approaches. One was to try to find a vaccine or a medicine, and the other was maybe more sanitary conditions, being healthier. Get out of the squalor of the city into the country, get fresh air. And so that's sort of the challenge that we have between, do you wait for the vaccine and get the vaccine? And all over the news this past week about, well, has the virus mutated? What does it look like? But in my career, there's been hepatitis scare. We started in dentistry. We didn't wear gloves. We mixed amalgam by hand in a squeeze cloth. Yeah. So then there was hepatitis, then HIV, which everybody started to wear gloves.
Yes.
And then there were other diseases, and now COVID. And there's no reason to believe that we're not going to have more and more as that goes forward. Mm-hmm. And what do? You lock yourself away until they find a vaccine. That's one possibility. But they've also found that healthier people, they may feel like they get the flu or a cold, and a couple of days they're sick and they're functioning better again. The problem is those two things shouldn't be in opposition. There's no reason why the vaccine should be available, but at the same time, that shouldn't be in place of being healthier. Yeah. I love the letter that your group wrote to the health ministry, trying to get them to listen.
Yes. Well, I think that's one of the things that has struck me around the world. Actually, I haven't seen too much change here, and that is that we've approached this pandemic the way we approach every chronic disease, and that is one disease at a time in isolation, as though one doesn't have any connection to the other. And I just see this opportunity. This is such an incredible opportunity, because we've got a world focused on health like never before. We can say that unequivocally. And this is an opportunity. We've got a captive audience that are interested in their health. And given the right opportunity, we could actually emerge from this a much healthier world.
And that was the philosopher, one of the best doctors I knew, my mother.
Yes.
My mother lived through the Spanish flu of 1918. Mm-hmm. One of her sisters died as a result of that, and there was nothing doctors could do about it. And then there were no even antibiotics up until World War II. And her belief was you had to get good sleep. The baby had to go out and get an airing every day. Even if it was cold out, you bundle the baby up in the crib, in the stroller, and took them out. You got to get sunshine on your face, vitamin D, and you couldn't be stressed. And everything was open 7 days a week. And on the days of rest, whatever it was, you just did nothing, and you sat around with your family, and social connections were important.
And everybody was eating organic food, because there was no such other thing except organic food in that time. It wasn't even called that.
One of my jobs was to go shopping with my grandmother, and they had just opened the first supermarket, A&P supermarket, in the neighborhood where we were. And she said, never buy anything in a package, because they're trying to hide something. That if you can't touch it, smell it, feel it, don't buy it. That was her belief. Mm-hmm. And so what has that been replaced with? That's been replaced by people picking up the packages, and they read the packages. Super fresh. Oh, must be fresh. Let me buy it.
Low fat.
You read what the advertisement says.
Yeah.
People don't know, and our tastes have been polluted. That here's an experiment anybody can do. Get up in the morning, have a glass of orange juice. It tastes sweet. Get up in the morning, brush your teeth, then have the orange juice. It tastes bitter. Why is that? Because All toothpaste has sweetener in it, not sugar, but it's artificial sweetener. And the way that we judge food is by comparison, one thing next to the other. Fresh vegetables are sweet, but not sweet compared to processed foods where sugar is added. So even though I believe sugar is bad, the real crime and danger of sugar is that you lose the ability to discern what's fresh and healthy. You take sugar out of children's diet, they will choose healthier foods.
Mm-hmm.
And dental decay is solely a disease of sugar. If there was no sugar, there would be no dental decay.
Yeah.
I was one of my best friends grew up in New Zealand, and he told me the horror stories of what they call dental nurses who came into the school, and they would pick people out from the classroom who would have to get treatment, and so he learned how to like slide under his desk and disappear under his desk, so he wasn't picked. And that's the way dentistry looked at things. When he really gets bad, let's do something. Let's treat it. But we're talking about COVID and the great potential we have to do something about it now. There's a lot of publicity and in the news about the vaccine. And unfortunately, the other approach, the more get healthy approach, even though there seems to be an incredible demand for it, it's not getting the press out that it should. Hopefully podcasts like yours and the webinars that we do will help get the word out.
I think I'm an optimist, and I actually do think that we are going to be faced with this. This may not sound like an optimistic prediction, but I think we're going to be living with this for the next couple of years. And I think in the next few months, and certainly in the next 6 to 12 months, I think people's mentality is going to come around to, hey, what else can we do? Because it was interesting. I was listening to a news program that did two stories juxtaposed on each other. One was the report of the rollout of the vaccine in America, in the US. And it was hailed as, everyone was being photographed having the shot, and they were being applauded, and isn't this terrific? Wow, the cavalry has finally arrived and we're going to be okay. And literally after the break, they went to another story about what's happening in Australia. And the medical officer in Australia said, listen, the vaccinations are not without their challenges. We're not sure about their efficacy. We're not sure about their side effects. We're actually not sure whether they will be effective on old people or on people with comorbidities, because we haven't really tested them on that. We don't know how long it will last. We know that it will reduce somebody's likelihood to get sick, but it won't stop them being infected or being contagious. So I think we need to explore. We need to continue with our social distancing, our hygiene, and other strategies to reduce our risk. And I thought the two stories juxtaposed in the one news bulletin really highlighted what was going on. And I believe we're going to be moving along, because there are so many issues still to be overcome in this vaccine, many of which I've just outlined there.
So a lot of the information that we put out in our webinars, which was mostly geared to practitioners, and we began to invite the public to listen in.
Yeah.
And we're also encouraging our practitioner members of our organizations. Most practitioners have a website or on Facebook. Share the information, because one of the things that's causing a problem is the unknown. And nothing is more fearful of the unknown. And if you just go back and you look at the news, how it changes every day. This is good, this is bad. Your stories are a prime example of that. We need leaders. We need people who are not leaders who are going to just give sermons about what you should do, but leaders who have the information and can share the information and answer questions. My patients ask me all the time what I think about the vaccine. I said, the results are great. I wouldn't be the first online to get it. Certainly the Pfizer vaccine, in there, whenever you do a study, you have including factors and excluding factors. And they basically only did the study on healthy people. They didn't do it on people who had a lot of comorbidity. And some of those people had side effects. There was at one time they were given Tylenol with the vaccine because some people were running fevers and nothing terrible. And so I say to myself, okay, what happens when you give the same thing to people with coexisting condition? Are they going to be worse off? Are they going to have more serious effects? Or maybe they won't. We don't know. And then having that knowledge of what you know and don't know, people can still choose to have the vaccine or not. But it's always good to have more information. And then the vaccine is something new. It's a messenger RNA, which they've never used before. Yeah. Historically, what do you do with a vaccine? You give somebody a little bit of dose of something, a weak dose, and your amount of immune system responds to that. And when you have something similar to that, your immune system recognizes. You're actually changing the way your immune system identifies things. You're reprogramming the immune system at a cellular level. It may be a breakthrough that'd be the most fantastic thing ever, but they've never done that before. And it's not something, whoops, this may not be as good as we thought of it.
We've rolled it out to 100 million people. Sorry.
How do you erase it?
Yes.
How do you erase it? So, but while at the same time, if you're going to wait and have exercise a certain amount of caution, why not spend the time becoming healthier? Why not spend the time looking at the things you didn't look for before? Everybody has more time. A lot of people have said, I want to get more healthier. I'm going to do that when I have time. Well, now there's time.
That's it.
No more excuses.
Which is, Howie, a great way of segueing into the book that you and Michael Gelb have written. It's called GASP, Airway Health, The Hidden Path to Wellness. And I actually thought, I wasn't sure whether I was reading this correctly, whether it was the hidden path or the Hindin path to wellness. But either way, you talk in this book. Huh?
I like that.
You hadn't thought of that? Oh, I thought it was a play on words. But anyway, Howie, you reference a term called airway-centric approach, and you've alluded to it. I wondered if we might just focus on that. What do you mean by an airway-centric approach?
Okay, so it comes from an old term in dentistry, maybe not so old, called centric relationship.
Yes.
That in dentistry, going back to the beginning of our conversation, we talked about TMJ, which is how the lower jaw and the upper jaw meet. And there are different beliefs in dentistry where it should be all the way back and forward, a little bit more forward. Michael Gelb's father, Howard Gelb, came up with the 4-7 position.
Yep.
And you would put different groups of dentists in a room, they'll literally kill each other.
Yes.
They wouldn't even talk to each other, because if you believe something different than they believe, it was blasphemy. It was terrible.
Now, Howie, before we go on, let me just explain to our listener about the various positions of the jaw joint. I think what people need to be aware of is the mouth is so sensitive, it can pick up 10 microns, which is half the thickness of a hair. And so when dentists were arguing about should the jaw joint be here, or there, what they were actually referring to was an area within a millimetre or 2, maybe 3, of each other. This was a huge argument. So this is what centric relation alluded to, which was finding that ideal position. Go on.
Because ultimately you wanted to rebuild the teeth and restore them, and you had to make them meet in a certain relationship to the jaw. So airway centric means instead of looking at any one of those things, maybe the best position for the jaw to be in is where the airway is the best, where the airway is the most open and people can breathe better. And so the next step was airway is the number one priority in treatment. That before you do anything else, you want to find a position where the airway is the best. That when somebody has a sleep apnea and they record the incidence of sleep apnea during the night, before every single episode of sleep apnea is a bruxism event. That's the way our brain tries to protect our airway by grinding and clenching our teeth together, which contracts the muscles of the tongue, tries to keep our tongue out of our airway. And so bruxism, or grinding or clenching of your teeth, is a sign of an airway problem. And many years of wearing away your teeth makes the teeth shorter and will make the house that your tongue lives in smaller because the roof comes down, because the teeth are shorter, and actually makes sleep worse, which will make the bruxism worse, and then it will be just self-perpetuating. So we try to promote the fact that airway should be the number one priority in determining how dentistry is done. And I would go, and even going back to what we said, you have to look at airway if you're looking at periodontal disease or you're doing detoxification. I talk to functional medical doctors all the time. You change the diet, you change the nutrition, you do everything really right. In some cases, miraculous changes, but if you're not looking at what happens at night when they sleep, 8 hours a day, 1/3 of their life, you're undoing that. You're missing something. And if somebody has an airway problem at night and they're not breathing well at night, they absolutely have an airway problem during the day. Your listeners can ask themselves, do you sigh at all? Sighing usually occurs after somebody forgets to breathe. And because we go about our day, we don't think about breathing, and we get really concentrate on something, and then we forget to breathe, and all of a sudden we realize we've forgotten to breathe, and we sigh and we take a deep breath. That's a sign of an airway problem. And so in our book we talk about airway centric, and the fact that my key phrase is the hidden problem, because I know absolutely 100% guaranteed anybody who walks into my office is breathing. They wouldn't be there if they weren't breathing. And so when I tell somebody they have an airway breathing problem, they could look at me like I have two heads. But they have other things. They have other things like neck pain, shoulder pain, children, chronic ear infections, trouble in school, ADHD, behavior problems, people who have high blood pressure, but under control with medication, except when they get up in the morning. Diabetics who they're under control with medication, except their morning sugar is high. What's the difference? And when you uncover or show them and treat their hidden airway problem, and it doesn't have to be with a dental device, it could be anything. There are other ways. My wish is that every single practitioner, be they a dentist, a physician, physical therapist, you name it, screen for an airway problem, and then get that patient to the appropriate hands of somebody who can help them. Or it doesn't have to be one practitioner. Sometimes it could be multiple practitioners. I don't know whether I've told you that one day a month I work with a physical therapist. I go to his office, and one day a month he comes to my office. And how we breathe, how we move is related to how we breathe. If we can't move our arms, we can't breathe. That we need that movement in order to move our rib cage and get things moving. So a dentist thinks about, well, airway is the nose and the mouth and the back of the tongue, but airway is much more than that. It has to do with what happens when we take a deep breath in and we expand, our lungs expand more towards the back than towards the front. We think about taking a deep breath and our chest expands, but our lungs actually expand more to the back. And we have patients who have, I've helped, but not as much as I can, but Brad, our physical therapist, finds their ribs aren't moving properly. They have poor posture. Their mid-back is stiff. Dentists, especially, sitting over a chair, the thoracic spine, the below the neck and above the lower back is very stiff. It doesn't bend. It's not flexible. So the two things that we do most now as dentists are work on patients and sit in front of Zoom screens, which we don't get a lot of mobility in our mid back, which is going to hinder our breathing. So if people get nothing else out of this podcast, is to recognize the possibility that an airway problem might be part of your problem, a problem of your children or your family, and at least ask the question. Go online. There's so much information.
Yeah.
Ask your practitioners. Do something, because if it's not a problem, you just move on and you do the next thing. But if it is a problem and if it's not addressed, you will never progress beyond a certain point.
Well, I know our listeners have been exposed to this. This is a topic we come back to frequently, and you will, of course, know Dr. Rosalba Courtney, who actually introduced us. Howie, she got us together, and you introduced me then to Sharon Moore, who I've done a wonderful podcast interview with recently about sleep-wrecked kids and myofunctional therapy. So it's a theme that I make no apology about regularly revisiting, because we need to be reminded of it. And I often say that if your practitioner hasn't even elevated it to the point of a question of significance, it's either because they themselves have a breathing or sleeping problem which they don't want to address, or they just don't know, and therefore it's not important to them or their patients, although it clearly is. There was another thing that you introduced me to, and this is what I have so valued about not only meeting you personally, but professionally, what I've learnt from you is the story of heart rate variability. And incidentally, I am now wearing a Whoop, which is a device that measures my heart rate variability. You introduced me to this term and related it as well to oral health, which even after 42 years, that was a total aha moment to me. Share with us what heart rate variability is and why does it matter?
So I think looking at heart rate variability is the communication tool that really will unite all people who are doing this kind of work. That we know what heart rate is. It's how our heart beats. So if we have a heart rate of 60, you might say it's 1 beat per second. But in actuality, it's not. If you measure the time between each beat, it could be 1 second, 0.9 seconds, 1.1 second. It varies. That variability between beats is called heart rate variability. Why is it important? Because every time you breathe in, your heart rate goes up a little bit. And every time you breathe out, your heart rate goes down. And looking at that variability is a way that we can measure the two parts of our autonomic nervous system. Our autonomic nervous system is the communication of our brain and our nervous system to the rest of the body, the part that never even consults us. It takes care of everything that we need to get done. It raises our blood pressure if it needs to be. If we are sitting down and we jump up too fast, sometimes we'll get lightheaded, and it could be because there's a lag. But generally, instantaneously, the blood pressure will be raised. I think I once told you an example from Nick Gonzalez's book on the autonomic nervous system, how miraculously it works. We're on an airplane. We're ready to get off the airplane. We have to get our luggage out of the overhead compartment. The minute we think about that, the blood flow to the muscles required to undergo that action, the blood flow increases to those muscles, only to those muscles and no other muscles. And so everything that we're doing is always an adjustment. From moment to moment, our temperature fluctuates. We now take temperatures if everybody comes into our office. And the variation in temperatures even from the same person every day varies. To stand on 2 feet and not topple over requires incredible amount of work. We reach over to get something, the muscles have to tighten on one side so we don't tilt over. So these are all the basic functions that's managed by the autonomic nervous system. And the autonomic nervous system has two components. One is the sympathetic and one is the parasympathetic, which is like yin and yang in Chinese medicine. The sympathetic or yang part is when we're putting out energy and doing things and expending energy. And parasympathetic or yin is when we're restoring ourselves and rebuilding ourselves. And life is about how well those two parts are balanced. All of the organs that are below our diaphragm are parasympathetic or yin organs. And so that, and the ones that are above heart, lungs, and are more yang or are basically more sympathetic. So that main line of defense, you are threatened, you're going to need to get more oxygen in so that you can fight or run away, get more blood flow, and be prepared for battle. When the battle is over, you go back to your little den or your cave, and you have your food, and you need to digest it and eliminate the waste. But in today's society, there are threats all the time. Even though you listen to the news about COVID, you're going to feel a difference. If you measured it with heart rate variability, you would see immediately that there'd be a shift more to the sympathetic side. And so having variability is good. The loss of variability is bad. Variability is a measure of your resiliency. And God knows we need more. We all need to be more resilient now. Resiliency is the ability to adapt to changes. Who are the most vulnerable to severe COVID? Those people whose immune system can adapt. Not that it's necessarily weak, but it might overreact. These are people who are stuck in this sympathetic tone. They don't have that resiliency or flexibility. And so you can measure that. There are different ways of measuring, like your watch, and then they have something called the Oura Ring. And there's more sophisticated equipment that has less artifacts and gives you a better result. But there are basically 4 things that I know of that will improve heart rate variability, which are better nutrition, better sleep and breathing, movement and exercise, and mindfulness, good thoughts, which I think are 4 of the 5 pillars of your healthcare system.
Yeah.
And so that different practitioners who are offering treatment, you will see an improvement with each treatment added to that person over time. Their health will get better. There is no drug pharmaceutical drug or medication that will improve heart rate variability. It may get rid of the symptoms, and you may feel better, but you won't actually be better. You'll be less symptom free. I look at it as heart rate variability is measuring imbalances in the body before they become diseases. Diseases are the expression of the imbalance. If you treat the expressions of the imbalance, you can make them go away, make the expressions go away, but you haven't addressed the imbalances. And so that expression will be taken care of until it comes up somewhere else. And so maybe all the different things that happen may not be separate diseases. They may be all manifestation of the same disease. Now they call Alzheimer's is now called type 3 diabetes. Glaucoma, they're calling Alzheimer's of the eye, because they're all similar. They all seem to have some component of chronic inflammation, and chronic inflammation caused by the same things in the world we live in. And if we look at those imbalances as a pandemic, it is far greater pandemic than COVID and all the other diseases that have occurred in a long time, because I'm sure in Australia, your population is healthier than ours.
It is, only
it's not because you're so healthy, it's because we're so unhealthy.
That's right. I was going to say, I didn't want to say you haven't set the bar real high there when you talk about it. We've got our own problems, but yeah, point taken. But listen, we have covered here a lot of territory, and I'm going to have links to this wonderful book that you and Michael have written, because there's so much great information in there. Howie, I wanted you to take a step back finally before we finish. Take a step back from your role as a dentist and as an educator, because we're all on this health journey in our lives. And I'm interested to know what you think the biggest challenge is for individuals on that journey in this modern world.
The biggest challenge is to know how to filter information. If I just go, for example, talking about mercury toxicity, when I first got involved in that, we had to educate people about what it is, why it was important. And this was at the time when the internet was just getting started. And then what happened, people have so much information, they would come in with the treatment they wanted to have because they read it on the internet. Or they know somebody, and I'll quote some people say, and you probably heard a lot of time, I know this person who had the same exact thing I have, and they did this and they got better. I want the same treatment, and maybe they had the same thing, maybe they didn't. So one of the most important thing is how you get the information, how you process the information. Can you find a practitioner who will spend as much time talking to you about what they're going to be doing as doing it? And it may not have to be the doctor themselves, but somebody on their staff. I find that now, post-COVID, when we reopen our office in June, people just want that time to talk and share what's going on and share their fears. Maybe it's a social isolation or whatever, but sometimes too much information could be as harmful as too little information.
Well, this information you've shared with us today is a very important part of that puzzle for people. And I'm really grateful for you for that. So, Howie, thank you so much for joining us today and sharing your wisdom with us.
It's been such a pleasure. I just love our growing relationship and the relationship of our organizations, and I look forward to seeing it grow, and together we'll help make the world a much better place. Thank you, Ron.
Thank you. Isn't it interesting? If you're a regular listener, you'll know I do like to ask my guests, and I don't give them any warning about this, about what they think the biggest challenge is. And often so many people relate that point about information and this overwhelming amount of information that's out there. And, here we are doing a podcast, giving you more information. But what I really believe in is about personal empowerment. And I also believe that people are very capable of dealing with information and assessing it. And if you haven't had a medical background or a health background, in health professions, sometimes assessing that information with an open mind puts you in an even more powerful position. And I'm also very often have said that as the world we live in becomes more complex, I believe the solutions are remarkably simple, accessible, and cheap. And that's why I focus on those 5 pillars of health and wellness, which incidentally also impacts on your heart rate variability, which also impacts on your resilience and your ability to deal with the stresses of our modern world. And the 4 pillars that Howie referred to was nutrition, sleep, exercise, and mind. My 5 pillars are sleep, breathe, nourish, move, and think. And I pulled sleep and breathe out for a reason, and that is that we also breathe during the day. And I believe there is a difference, as you will have gathered, between just breathing and breathing well. I just love talking to Howie. And honestly, after 42 years of clinical experience, to listen to somebody who has even more experience than I do and learn so much. I mean, his heart rate variability, his categorizing of the yin and the yang, that the yang is that above the diaphragm, the heart and the lungs, preparing us for fight and flight. The yin is below the diaphragm, the parasympathetic nervous system, our internal organs. I'd never heard that. I'd love that. And the whole business of heart rate variability, which we're definitely going to be doing more episodes on coming up. And as I said, I'm exploring it by wearing a device, which I really don't like to wear. I don't like wearing these devices, but I thought I would for the next month or two just to check on my heart rate variability and also to remind myself about how important sleep is. Look, it's a great book. It's a terrific book. GASP, Airway Health, The Hidden or Hindin Path to Wellness, and we'll have links to that. I hope you had a good break over the summer. I hope you enjoyed our summer series. We've got some great things planned this year. Don't forget to download the app, Unstressed with Dr. Ron Ehrlich. There's going to be a lot of information flowing through that. There's online courses available. We'll be hopefully running some face-to-face workshops. Who knows what this year how it will all unfold. And, of course, don't forget to leave a review on iTunes. I'm getting my head around social media. I'm learning to swipe right and do all sorts of different and creative things. I'm going to be having some fun with that this year as well. So I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.